hip ADDUCTION or hip adduction versus hip abduction or abduction are exact opposite movements of the hip joint relative to movement with respect to the center line. So in running, hip adduction is when the hip angle is less than 90 degrees. So as we can see with this runner here, at mid stance, that angle is less than 90 degrees. So she is in hip adduction. Another way of looking at it is when the pelvis drops below the horizontal when standing, in this case on the left leg. So we can see the right hip is 5 degrees lower than the left hip. And it should be noted that hip adduction is a sliding scale. There can be significant variations within the amount of hip adduction we see within runners. Another point to note is that it is very common when someone has a weak lateral hip, so lateral hip being most notably gluteus medius, but clearly also gluteus maximus, the main glute muscle, is we have a tendency to see a trunk shift to the side of the supporting hip. So we can see her trunk is leaning to the left, and that is a strategy to gain stabilization about a weak lateral hip. And corresponding with that, again we are in mid stance, we can see that we have what is called a medial knee drift, which is when the knee has dragged in towards the center line. So the most causative factor of this is a weak lateral hip, but it can also be relative to weakness on the opposite side obliques, and also in this case the left VMO or vastus medialis, the inner quadricep muscle. So that is hip adduction.